Not be cheap. Nan Hayworth is a doctor and a former congresswoman, and she joins me now to talk about this. Something like $32 trillion is what this program would cost over a certain amount of years.
Over 10 years.
Over 10 years.
Right.
Let me ask you, though, is that more or less than we're all spending, businesses, people in general, are spending on health care right now?
You're absolutely right, Rob. We are spending more than we should be on our health care. We're not getting full value for money. But you have to add that projected $32 trillion, which George Mason's a good place, with the already projected tens of trillions of debt that we will owe based on the Medicare program that we have now. It is the single biggest driver of our debt, believe it or not, and of our projected debt for the future.
So you think healthcare gets more expensive if we move to this single payer option?
And why, Rob? Because whenever the government is in charge of things, the decisions become political.
Right.
And we've seen it in everything government touches.
And they're not good at making deals. They're not good at making things effective, cost effective.
Because, big healthcare, big insurers, big hospital entities, big pharma, and they all play a role in our healthcare, and we want them to be healthy, but they tend to sidle up to politicians and get the deals that they want.
And they see that big pile of money and they just lick their lips.
And when Uncle Sam is paying, providers tend to charge more. And that's a big problem. So it's cost, it's debt, and it's allocation of resources.
The popularity of Obamacare has skyrocketed recently. I mean, it was down in the 30% range a few years ago. Now it's up close to 60% right now. It's very popular. I can't help but think the reason why is that the Republicans talked all this trash for all those years and had no solid replacement for this plan. And if they lose next Tuesday, a lot of it will be on the Republican Party.
Well, I agree with you, Rob, that the crucial aspect that Republicans, two aspects that they have failed to emphasize. One is that no Republican wants to eliminate coverage for pre-existing conditions. Everything we've ever done is meant to help people with pre-existing conditions.
Not according to the Democrats.
But the Democrats are propagandizing that. What Obamacare did was basically, it was $1 trillion gift to the bureaucracy and the insurers at premium payer and taxpayer expense. And one of the reasons that Obamacare maybe isn't as unpopular is because the Trump administration has actually done things to help consumers have more choice and more competition. So that's taken some of the negative off Obamacare. Now,
you're a special person. You're a doctor and you are also a politician at one point. So I want to ask you straight up, what do you think health care in this country should look like? Because not many people know both sides like you do.
Well, you know what, Rob, we can look at what President Trump and HHS have done about facilitating association health plans, letting small businesses band together across the country so that they can force insurers basically to give them choice and competition, lowering the cost of plans, making them more affordable, not having government mandate everything that these folks have to do. And that's a vision for the future. Give
That's the most cost-effective vision you think that gives you the best health care.
Exactly. Insurance should be for the big costs, the big expenses. And if we actually rationalized our insurance plans so that people could actually afford their insurance, then the cost of our routine care would also go down.
Okay. Doctor, thank you so much for coming on today. We do appreciate your time.
Thank you, Rob.